Good afternoon and welcome to the MRF's Ask the Expert, Session 2 with DermTech, the importance of challenges of early detection. First, I would like to thank our speakers, Dr. Ann Mazer-Reed, board certified dermatologist with Rendon Center for Dermatology and Aesthetic Medicine in Florida, and Dr. Daniel Siegel, clinical professor of dermatology with SUNY Downstate Medical Center and Chief of Dermatologic Surgery of Brooklyn Veterans Administration Medical Center, for joining us today for this very awesome session. I'm Cassandra Beisel. I'm with the Melanoma Research Foundation. I'm the Senior Advocacy Officer and three-time cancer survivor. The Melanoma Research Foundation is the largest independent organization devoted to melanoma, committed to the support of medical research in finding effective treatments and eventually a cure for melanoma. The MRF also educates patients, physicians about prevention, diagnosis, and the treatment of melanoma. The MRF is an active advocate for the melanoma community, helping to raise awareness of this disease and the need for a cure. We'd like to highlight our partner, DermTech, who is a proud partner for this session. DermTech is a leader in precision dermatology enabled by non-invasive skin genomics platform and is partnering with the Melanoma Research Foundation to host our first Ask the Expert series this year, which will occur throughout the month of January. This series will focus on the importance of early detection, as well as the delays in skin cancer screenings and diagnosis due to the COVID-19 pandemic. DermTech is a leading genomics company in dermatology and is creating a new category of medicine, precision dermatology enabled by non-invasive skin genomics platform. DermTech's mission is to transform dermatology with their non-invasive skin genomics platform across the high quality dermatology care and improve the lives of millions. DermTech provides genomic analysis of skin samples collected non-invasively by using an adhesive patch rather than a scalpel. DermTech markets and develops products that facilitate the early detection of skin cancers and is developing products that assess inflammatory diseases and customized drug treatments. The MRF knows that education is critical for patients making informed decisions about their care. That is why we are thrilled to partner with DermTech on our Ask the Expert series, which aims to touch topics to help educate and empower the melanoma community. Today is our second session, which will be focused on the importance of early detection and changes that can be faced in this process. We encourage people to use the comment section to ask questions, which will be addressed at the end of today's session. The information presented during today's session is for educational purposes, and any treatment questions should be directed to your healthcare provider. We would encourage everyone to visit melanoma.org to utilize the free resources like our treatment center finder or clinical trial finder. We also have a free Ask the Nurse service where patients can connect and ask questions. Now, I'm going to turn it over to Dr. Reed, who will be followed by Dr. Siegel to share about this important topic. Dr. Reed?
Hi, everyone. I'm Dr. Ann Mazer-Reed. I'm just going to share my screen here so you can see. Okay, perfect. So I'm Dr. Reed. I am from Boca Raton. I'm a board certified dermatologist at the Rendon Center. And we're going to discuss a little bit about the importance of early detection of melanoma. So skin cancer is the most common cancer in the United States, but actually most skin cancers can be prevented. I have some useful information from the Skin Cancer Foundation. Nearly 5 million people are treated for all types of skin cancers, and it's very costly. About every year, about $8 billion it requires to treat skin cancers. So there are 76,000 new cases and 9,000 deaths from melanoma. This is the deadliest form of skin cancer. So the most common cause of skin cancers are exposures to UV rays. So you can get this from tanning beds, but also from the sun. So it's important to protect your skin from the sun. And it's also important to note that anyone can get skin cancer, no matter their skin tone. So everyone should be protecting themselves from the sun on a daily basis. I am based out of South Florida, where it's very, very sunny here. So we always encourage the use of sun protection. 1 in 5 Americans will develop skin cancer by the age of 70. So that's 20% of us that will develop skin cancer. So again, another reason why we need to protect ourselves from the sun. This is something we can use to help prevent skin cancers. So in South Florida, most people have had sunburns, and your risk for melanoma doubles if you've had more than 5 sunburns, which is pretty common down here in South Florida. More than 2 people die from skin cancer in the US every hour. So, as important as it is to protect your skin, it's also important to protect your children's skin. Most of our sun exposure and sun damage occurs before the age of 18. And 1 blistering sunburn as a child doubles your risk of melanoma as an adult. So we have to be advocates for our children and make sure that we're also putting on sun protective clothing and SPF as well. The good news is that if we can detect melanoma early, the survival rate, so the survival rate of all stages of melanoma is about 92%. If we catch it early, it bumps it all the way up to 99%, which is very encouraging. So you do want to make sure that you're getting your skin checked. You're seeing your dermatologist at least annually, or if you have a history of skin cancer, you're seeing them more frequently. And if you notice anything on your skin that's new, that's changing, that looks different to you, you definitely want to get it checked out. It's really important. I know that in other parts of the country, people are not really going to doctor's offices. There's a lot of telemedicine that's being involved. There are ways to get your moles checked virtually, and there are ways to test your moles through telemedicine through a board certified dermatologist. And we'll get a little bit more into that later on. So this is a good chance to talk about the A, B, C, D, E's of melanoma. This is kind of what we tell our patients to look out for. So A is asymmetry. So if you can see my mouse here, or if you can't, the first image at the top is if you cut it in half and you fold it upon itself, it is not symmetric. So that's a mole that's asymmetric. B is for border. So the border of this top lesion here is very irregular. So that's something we want to look out for and bring up to your doctor. C is for color. So color changes if there's multiple colors in a mole. D is for diameter bigger than 6 millimeters. And E, which I think is the most important letter, is for evolution. So how have your moles changed? Are they used to be one way and now they're another? Definitely something that you should have checked. And skin cancer doesn't check itself out. So it's important to be an advocate for yourself. And self-skin exams are as important as going in to check your skin with a doctor. So the way we do a self-skin exam, this is from the American Academy of Dermatology. So you use a mirror. So you examine your whole body front and back in the mirror, get used to your moles. You know your skin better than anyone else. Look at your left side and your right side, raise your arms up, look at your legs. Remember to look between your toes. You can use a mirror to check your back, bend your elbows, look at your underarms, your palms. And if you notice anything changing, you definitely want to make an appointment, whether it's a virtual appointment or an in-person appointment, to have your moles checked. So genomics has been around for many, many years. That's the genetic testing of cancers. It helps us diagnose cancers, and it also helps guide treatment. So breast cancer, colorectal cancer, prostate cancer, they have been using genomics for a very long time, and dermatology is breaking its way into using genomics for diagnosis and treatment of skin cancer. So it's now revolutionizing cancer care. So we are able to diagnose things earlier We can detect cancer before symptoms are present, and that does increase significantly our treatment success and survival rate. Genomics can fast track treatment. So let's say we have a mole that's genetically atypical. We don't even biopsy it. We go straight to removing it. So you're skipping a step and fast tracking the treatment of that specific mole. It can also help determine how we treat it. So what chemos are we going to use? What medications, what dosage will be beneficial? Genomics is objective, meaning there is no opinion on it. It's yes or no. So normally we do biopsies, and this leads us to subjective responses. So our dermatopathologists, who we love so much, it's their opinion of that specific biopsy. Whereas genomics, when you're testing genes in a mole, that is a yes or no. Is the gene there or is it not there? So we do have the ability to non-invasively check moles. So I present the SMART sticker. So this is the DermTech pigmented lesion assay, and it is changing the way we detect skin cancer. So that's the exact size of it. It's very simple, it's painless, it's non-invasive, and it is genomics. So it is testing the genetics of our moles. It is simple to apply, and the results of this test leads us to how we are going to treat these lesions. So the SMART sticker, it actually tests the entire lesion. So the entire mole is getting tested versus when we do a biopsy, they do what's called bread loafing, where they slice the biopsy into slices basically, and they choose a few of them, and that's what's read by the pathologist. So that doesn't test the entire mole. So if there's one cell of melanoma in the test, they are going to, in the test, and they don't see that on the slide, they can miss that. So this gives us a little more reassurance that the entire mole is being tested. After we do the sticker test, we send it to the gene lab. The gene lab analyzes that test for RNA and sometimes DNA and gives us a report. The report that the physician or provider receives will allow us to decide how we're going to treat that lesion. If it's negative, we're perfectly happy with leaving that lesion alone and just monitoring it closely. If it's positive, then we're probably going to do something about it. So I'd like to present a few of my personal patient cases of pigmented lesions that I have used the DermTech on. This is our first patient. She's a 75-year-old female, and she had a pigmented lesion on her back. She also came in for a full body skin exam and had a few other lesions that we were biopsying because they looked like skin cancers to me. And this spot she did not want to biopsy. So I performed a SMART sticker test on it. The SMART sticker, this is what the report looks like when your provider receives it. This patient specifically had a what I call double positive test. So the gene link was detected and the gene prime was detected. So for this spot, I went straight to an excision. I did not biopsy this spot. I cut it out immediately and I sent it to the lab. This is the lab report that I received, and I'd like to guide you to the lower part where it says no residual dysplastic nevus, changes of prior biopsy site. So I just want to remind you that I did not biopsy this spot. So I called this dermatopathologist and I said, can you take a second look at that? Because there was no biopsy. So I'm wondering where the pigmented spot is. So she ran deeper, we call them deeper sections, and she called me back and she said, well, I found a mildly atypical junctional melanocytic proliferation, which was margins free, which means the whole thing was out. And she said she saw underlying fibrosis and pigment incontinence, which is why she thought it was a scar initially. So this was eye-opening to me. I always stay in touch with my dermatopathologist, and I always make sure that whatever I receive on a report, I agree with clinically. So I'd like to bring you to my second patient here. This is a 56-year-old man that had a pigmented spot on his right lateral neck. And he has another pigmented spot below it and to the left of it. So this spot to me didn't look like something I needed to biopsy right away, maybe something that we would monitor. So we decided together to do a sticker test on this patient. He did have a single gene positive, which is LINC. This is associated with a 7% chance of melanoma, according to their studies. So I biopsied this lesion. To me, it was only LINC positive, so I thought a biopsy would be appropriate. This was melanoma in situ. So this was extending to the peripheral margin. I scheduled him for an excision and it was completely clear. This is a perfect case of early detection of melanoma. My next case is a 29-year-old male. We did 2 smart stickers on him. He did not want biopsies. He had a history of atypical moles, and he said, all of my past dermatologists have done way too many biopsies on me. I do not want one. So I offered him the smart sticker and we performed it on 2 lesions. To me, this lesion is atypical. It has 2 different colors. It is not symmetric. It has sort of an irregular border. So I did a smart sticker on it and it was completely negative. So our negative predictive value for a DermTech Smart sticker is 99%, which means there is only a 1% chance of missing melanoma. To me, I am comfortable with leaving this lesion and monitoring it closely. So I have him come back in 3 months to check that spot. The second lesion that we performed was on his abdomen. We did a smart sticker on this one. So this is not asymmetric. It does not have an irregular border. The color is perfect, does have a large diameter, and he told me it was not evolving. So good lesion for a smart sticker. This one was positive. So this was LINC positive, and I performed an excision. So I went to cut it out. It ended up being a compound nevus with moderate dysplasia. The important thing is that it's margins free. Now, moderate dysplasia can turn to severe dysplasia, which can then turn to melanoma in situ. So another example of early detection of melanoma. This patient is my next case, a wonderful 66-year-old female. She came in for a skin check. She had the spot on her neck. She told me she's had this spot forever. It wasn't changing. It looked perfect to her. She wasn't worried about it. She did not want me to biopsy it. We discussed a sticker test. So she allowed me to perform a sticker test. It came back positive. This patient was, then we asked her to excise it. So we actually set her up for an excision. This was my excision margins. I used around a 4 millimeter margin for it. It was malignant melanoma, superficial spreading type. So this patient I did send again, the margins were positive on her because I don't like to take a very large margin when we don't know exactly what it is. Like you saw in the case before, it could have been an atypical mole. So I sent her to plastics to have the rest of it removed. She's doing perfectly. Everything is out, and I have her on a 3-month follow-up for skin checks. My next patient is a 62-year-old male. We did 2 sticker tests on him. This was the first one on his right lumbar back, large lesion, has a little notch in it. We performed a DermTech, was completely negative. I am comfortable again leaving these lesions, no need to take them out. We just monitor them closely. Second lesion on the chest, he said he's had since he was a child. It was changing a little bit. So he noticed a small brown dot in the center of it. So I performed a DermTech on this lesion. This was double positive. So with this specific spot, I decided to remove it completely. We performed an excision. This was after the excision, immediately after, and it came back as melanoma. He was lucky it was completely excised, so we didn't need any further treatment for this spot. We do have him on 3-month follow-ups, and he is very grateful for the smart sticker. And that's it. Thank you very much from sunny Boca Raton. Thanks for joining us, and thanks for having me.
Thank you so much, Dr. Reed. That was fascinating and super informative. I appreciate that. Next, I'd like to turn it to Dr. Siegel for his presentation. Dr. Siegel? It looks like we may have, oh, he's getting back on here. Excuse us while we wait for Dr. Siegel to get back online. It looks like he may have been booted. So I apologize for the wait for that. But here he is back now. Dr. Siegel?
Hi there. I just had a problem where my computer just died on me. Literally just it went blank despite being plugged in. So I'm on my iPad. Is it possible for you to bring up my presentation since uh, I don't have it on the iPad?
I'm sure there's something we can do to help.
Because this was a novel phenomena. I can't figure out why, but my MacBook Pro is dead as a doornail right now.
Yes, if you can go ahead and send your presentation to our team, we'd be more than happy to get it up.
The computer is dead.
Okay, the computer.
I can't get into it right now, and I don't know if I can get into my Dropbox. It just yeah. Let me take off the headset here and put a place in the house. You guys, yeah. So if you have the lecture I sent you yesterday, or if we just do questions from Randra, I can see about what I can do to.
Okay, well,
Get this
while
back, possibly.
we go ahead and wait for you, we're going to take some questions from the audience regarding Dr. Reed's, and then we'll come back to you once we can figure that out. Does that sound like a plan?
Sounds like a plan.
Okay, we'll be right back with you. If you want to go ahead and mute yourself, we'll go ahead and take some questions from the audience. So Dr. Reed, what are some of the challenges for communities that are more rural and lack access to gaining early detection in genomics available in the UK?
So the UK, I can't speak for. I only speak for the United States here, but I do know that since the pandemic, we've had great support with telemedicine. So you can find a local board certified dermatologist that's in your area and sign up for a telemedicine consult. Let's say you're having an appointment with me. We will do a virtual consultation. I have you send me photos of your specific lesions. Most of our iPhones can take really great photos. So I review the lesions, and if they look suspicious to me, or if you're uncomfortable with that specific spot, we can actually send to your home very safely a DermTech sticker test. I can show you over a virtual consultation how to perform it, or there are some great videos online through the dermtechcom website, and they will walk you through performing the sticker test. I receive the test in just a few days, and I call you and I let you know whether there's something we need to do about that specific spot. So don't feel like, you have to go out to a doctor's office, or if you can't make it to a doctor's office, you can get these pigmented lesions or brown lesions. You can have them tested at home safely.
Wonderful, thank you. Next question. Do you have any recommendations for those who are uneasy to visit their dermatologist office to get an annual skin check due to the pandemic?
So that's sort of what I was just discussing. So, full skin checks, we won't be able to perform. Obviously, it's going to be a little difficult on a virtual visit, but we can, if you have specific spots that you're very worried about, we can definitely look at them over the computer. Through my email, I receive photos. And then, like I said, we can send the DermTech sticker test to your home. And if it is something that we feel needs to be treated, we have you come into the office, and we have very strict protocols in our office. And we feel like in Florida, at least, we are able to treat our patients safely. And I believe through the DermTech website, you can find a provider in your area. You just type in your zip code and they'll help you find a physician that performs the DermTech.
Great. Let's see. We have another question here. Can a non-invasive test be conducted at home if a suspicious spot is noticed?
Absolutely. So again, very similar answer. It is a really easy test to do. It's literally, you clean the skin, you rub the skin, you put a sticker on it, you repeat that 4 times, and you fill out a paper. It's super duper simple, non-invasive. Only thing is, if there's hair in the area, you might have to trim the hair the hairy area down. Sorry, I got tongue tied. But yeah, super simple and easy to do.
Are persons of color more at risk for lack of early detection?
So absolutely. So I feel that sometimes people of color believe that they are not prone to skin cancer, and that is not the case. Skin cancer affects every single color and race. So there is a minor protection from the sun from having larger melanocytes in the skin. However, you can definitely, and I have personally treated many patients with skin of color and skin cancers. So it's absolutely important to get your skin checked, to wear your sun protection, and if necessary, come in for skin cancer removals, but definitely need to test your moles.
Okay, we have another question here. Do you believe that non-invasive testing potentially will replace biopsies?
So I don't think so. I think there will always be a place for a biopsy. If I am doing a skin check on a patient and I see something that looks like melanoma, I am not going to sticker test it. I'm going to cut that out. I will never leave anything that looks bad on the skin. So while we definitely cut out things that look like melanoma, there are borderline lesions. There are things that, they look fine, or under a dermatoscope, they're, maybe something we'll take a picture of, have you come back in 3 months, check it again. So now instead of taking a photo and monitoring it, I take a photo, I do the smart sticker, and I monitor it. So that just gives us an objective way of either reassurance or telling us, we got to cut that out. That should not be staying in you.
Great. And what do you think about, so when we're talking about, health equity is such a big thing right now. And for those living in a rural community, do you think that something like this DermTech sticker is going to be one of the areas that will replace, and I know we were talking about replacing traditional biopsies, but we know that a lot of people have problems accessing a dermatology, or there's one dermatologist for a small rural town and they necessarily can't get in. What do you think are the best ways that those folks can approach, a DermTech sticker or something like this to do something at home, maybe versus with a telehealth visit?
Absolutely. So, the silver lining of what's going on right now is that access to medicine virtually is way better than it used to be. So like I said before, I believe it's dermtechcom. Someone can correct me if that's not the right website. But if you go on their website and you click on find a physician, you can find a physician in your area, or maybe not even in your area. Maybe it's, maybe it's me, maybe it's Dr. Siegel, maybe it's somebody that takes your insurance that could be 20 miles away. Set up a virtual appointment with them, let them know what you're worried about. And absolutely, this allows access to patients that normally wouldn't have access to these type of tests or to a skin check in general.
That's really good to know. So dermtech.com is the proper website. So what you're saying is that a patient, even if they don't have a dermatologist or someone close, they can go on to dermtech.com. Someone in that organization will be able to help them find somebody who uses these stickers to perform a telehealth biopsy in a sense and get them going. So that is wonderful. And is this covered by insurance? These stickers, these DermTech stickers?
Yeah, so most insurances cover this sticker test. So I haven't really had any issues with my patients in the past. I know Medicare covers it and most commercial insurances cover it. So there shouldn't be an issue. You can always contact DermTech and find out whether they take your insurance or not.
Wonderful. Well, thank you so much. I think there's still difficulty with Dr. Siegel's presentation, so we're going to go ahead and close out for the day, and we'll bring that back for another session. With that said, this concludes our second Ask the Expert session presented by DermTech. If you are looking for more resources, please visit the MRF's educational research page on our website at melanoma.org. The third Ask the Expert session will take place next Thursday on January 21st at 12:30 p.m., 9:30 a.m. Pacific Standard Time on our Facebook Live page, in which we will hear presentations from Dr. Stephanie Diamond, MD, FAAD, who's a board certified dermatologist at Advanced Dermatology, and Dr. Chris Adigun, MD, FAAD board certified dermatologist at Dermatology and Laser Center of Chapel Hill in North Carolina, who will discuss an overview of PLA and the advancements made in telemedicine. Again, the MRF and our partners at DermTech would like to thank Dr. Reed and Dr. Siegel for their time. Wonderful and informative presentation, Dr. Reed, Dr. Siegel. We look forward to seeing yours at another time. And thank you again for your expertise. We will see you all again next Thursday. Have a great day. Thank you so much.